Everyone loves a good hip flexor stretch. In today's video, I'm going to show you a good, a better, a best, and a bestest way to stretch that hip flexor and the tight tissue on the front of the hip. Hey everyone, Tom Swales here, Advanced Movement Therapist. Today's video, we're going to go through 4 different variations to open up the hip flexors, the tissue on the front of the thorax here, all the way down into the knees here. So the typical hip flexor stretch, a good majority of the time, people are lunging and they're going into the lower backs. They are driving into their knees. But the point of this stretch is to stretch the tissues on the front of the hip flexors into the lumbar spine and down to the knees. So the traditional stretch for the hip flexors, we need to set this up right because it's all in the setup. So when we're doing this, we want to get nice and tall. We want to create a posterior pelvic tilt. So we got to lock that glute on. Then we're going to stabilize on the front. We're going to press the hands into the thigh here, and that activates the anterior core. So now I'm locked up in my lumbar spine to protect that. And the only place where stretch can occur is on the front of the hip here. So if I lock all that up, I go into first tension. That's about all I got. But if I let all that go, I can go further, which is not a bad thing if we're looking to increase hip extension. But if the goal is to stretch the tissue on the front of the hip here, we need to be very specific. So we're going to square up, lock down, set the inner core, and go here. Now I can go further, and what you're going to do is you're going to monitor, can I keep that glute on? If that glute turns off, you've blown past your range of control. So now the muscles on the front are firing up so much that it's creating inhibition on the back here. So we need to keep tension here. And if you can hold on to that glute tension while you go into a deeper range, then you own it, okay? But make sure tight, and there should be no pinchiness in the low back. The better variation of this, we're going to utilize greater contraction on the posterior thigh here. So we're going to get some facilitation from the plantar flexors, the calf, the hamstrings, and the glutes. Because when we can turn these muscles on, we can better relax these muscles and get into deeper stretch. So I'm going to set up with my foot pressed into the wall here. So I'm going into plantar flexion. Okay, so I got that calf turned on. I'm going to push the wall away. So I got my hamstrings and my glutes firing up. That's going to allow me to move deeper into this hip here. I'm still going to use that anterior core set. So if you need to press here to keep that on, go for it. So now I can get into there and I can press that wall away and get into a little bit of a deeper stretch. If you feel like you've got security here, you're good. You can bring that arm up overhead to further go into the tissues that continue on into the fascial arm lines. Moving into the best stretch, we see this kind of wall or couch stretch, and this now incorporates a lot of the quad muscles. So that rectus femoris crosses into the pelvis and has influence over the pelvis control. But just think of fascial lines. You know, everything is kind of continuous through the body, either on the front side rotation or spiral lines. So now we're going to emphasize a little bit more stretch into that knee area. Same principles and rules apply. Set that core, lock that glute, and lunge into it, okay? So if you can keep those locked in, then we're good to go. If we want to emphasize a little bit more stretch in that quad, then we're going to lean back into the wall. Same thing. Can I keep that glute on? If I can't, or I start to tilt and lose that pelvic position, we're not stretching the quads anymore. We're just going to dip into our back. So keep that locked in, and we can add on a little bit of reach to go after a few more things. I can add a little bit more side bend to open up more of this lateral line. And if I rotate, I can then add on some of the spiral lines. And then the bestest of this stretch, I know the English is good. So we're going to grab a kettlebell. We're going to add compression. We're going to incorporate the grip to get that irradiation and that nervous system organization going. I'm going to grab onto that. I'm going to press it up overhead. So now I'm adding compression through the body to help facilitate spinal stability. And I can rotate towards, and I can rotate away, okay? But with the weight on the same side arm, I can really emphasize that ipsilateral flexion of the shoulder and extension of the hip. And then if I switch it over, now we can work cross body. So we're working on different fascial lines here. I can lean back into the quad, and then I can rotate away to work on more of that rotation line, or I can rotate towards. Everybody's going to come in at a different level of mobility, strength, and control. So don't jump to the most complex or the most challenging stretch in this exercise or in this series. We want to feel stretched, but there should not be any pain. And if you are struggling with your breathing, if you're holding, if you're bracing, you don't own that. So take a step back, make sure you can breathe, be comfortable, because like anything, improving flexibility takes time, just like strength and control. If you like this content, subscribe to my YouTube channel. If you are looking to upgrade your clinical practice or your sports performance coaching, head over to amtcertified.com and get certified today.